Thanks for inviting me. The topic I think is quite pertinent. So we'll just look at what stigma is. I'll give you some kind of a historical perspective, and then I will also look at how we can address some of the issues. So, stigma by definition is shame and disgrace that results from prejudice associated with something regarded as socially unacceptable. And it is a multi-dimensional concept. So social stigma, which is basically what stigma does encompass, is when you are ostracized or treated badly because of some characteristic. It is kind of something that an individual has little or no control. There are various, issues around it in terms of across different groups and in different time periods has been shown to be a problem. But actually, it dates back to the Greeks in terms of some sort of definition. And in this book that was written by somebody called Evan Goffman, does define it quite well. It simply means that you kind of like have a cut or some burn marks into the skin of criminals, and slaves and traitors to identify them as tainted or immoral people that should be avoided. I think that's kind of a very powerful kind of definition. And then also we know that as applied generally, it's got to do with people's physical features, especially things that are undesirable in terms of visible disabilities within a culture. So, for example, people with, physical, disabilities, like people who might be in a wheelchair, for example, and also, mental health and other intellectual issues have been shown. So people with learning difficulties that can be identified, people with schizophrenia, some cases depression as well. So it's still a big thing within mental health. And in terms of behavior, it's when people kind of fail to adhere to specific norms of the society or culture or within some sort of a group. And also it implies being in a group but being excluded. So you could be excluded from membership in a race, a caste, a tribe, a religion, or other group that is devalued in society. And so these are some of the words that people have used to describe stigma. Things like guilt, humiliation, disgrace, prejudice, being shunned, being embarrassed, being isolated, being ashamed, being lonely, being disapproved, being different, being devalued, and in terms of things like being worried and also sadness. But we may all know a famous Nobel laureate by the name of Linus Pauling, who actually describes sickle cell disease or sickle cell anemia as a molecular disease in terms of his work. But also he did create some controversy by saying that he said, I have suggested that the time will come in the future when information about heterozygosity in such serious genes as the sickle cell anemia gene will be tattooed on the forehead of the carriers, so that young men and women would at once be warned not to fall in love with each other. And this is way back in 1966. But I think the key thing about this is that if you look at the original Greek definition that I showed, it's about people being tattooed with something so that they are kind of identified. But importantly, I think when you look at certain places across the globe, and in Africa, for example, when you talk to, let's say, government or policymakers about sickle cell disease, they always use the kind of word about controlling the number of people, and which in a way depicts how people are looked at it. So that their idea of controlling the number of sickle cell people might be that you stop people who are carriers from getting together, and that is the way that you show that. So that in itself highlights some of the major challenges that we have with stigmatization. The other thing is, also in terms of the American history, so leading on from that, in the early 1970s, African Americans were stigmatized by their carrier status and denied health and life insurance, and they were prevented from employment opportunities such as joining the U.S. Air Force Academy. And in terms of screening, when that started, there was a lot of discrimination around that, and African Americans, in terms of what happened to them, were quite angry that they were being further discriminated for simply being a carrier of sickle cell trait, and that fed into things like their employment and so on. But having said that, things are not much better over here, and this was from a blood campaign by the NHSBT for blood donors. And actually, so in the tweet that was being sent out regarding the campaign, somebody actually tweeted back to say, if we deport all blacks, this will stop being an issue. And the donor campaigners then tweeted back and said, or we could just deport you. So it just shows the ongoing public attitudes towards people with sickle cell disease, and that obviously is very stigmatizing from that point of view. Within sort of our own work and the kind of patients that we work with, they are from various backgrounds. We have African patients, Ghana, Nigeria, whatever, Caribbean, and these issues still go on. So sometimes you have society's attitudes, from the example that I showed, for example, which is to do with the myths and the misconceptions, and also in terms of discrimination, yes. But there are also cultural and religious factors. So there are things around beliefs and practices. There are issues about what people think sickle cell might be caused by. And in some cases, people will seek, divine intervention in terms of if sickle cell is deemed to be, something of divine retribution, like a punishment or whatever. And, we've heard cases of sometimes actually parents taking their children to the pastor of their church, as a start, instead of going straight to A&E when things are really, really quite bad. And that is all around the beliefs. I'm sure we've all heard about patients also talking about praying so that they would be cured of sickle cell disease. In some cases, they might, refuse certain interventions and say that they are kind of relying on prayer so that they will be healed and so on. And then there's also the issue about family genetics, especially within the African culture. You find that, there is a lot of blame on mothers simply because they are childbearing. So if there is something to do with sickle cell disease, people would, especially the men, would say that no, it has nothing to do with their family, but it is, his wife or the woman's or his partner's family. The women are the ones who are, obviously looked at in terms of when it comes to sickle cell disease. They're not understanding that it is something to do with two genes from either side. So these are some of the issues that I think culturally are quite stigmatizing. There are other issues, and just to highlight a few, in terms of some of the psychosocial things that might happen, in terms of newborn screening, we know that our specialist nurses do home visits for newborns and, have to take the results and do counseling and so on. And sometimes they are seen as, people who bear bad news, and that is really quite, and in some cases I've heard that, nurses might go into people's homes and they might not want other people in the home to know that they've come to counsel them about sickle cell disease and, so many issues, and not trying to let people know that there's a child with sickle cell disease. That can be stigmatizing for them. We also know that there are certain visual complications. We know that there's delayed puberty and growth, and in a lot of cases, we see children with sickle cell disease quite small to start, even though in some cases they will eventually grow to become quite big and tall without not, knowing that they have sickle cell disease. But jaundice in particular, I think it's a visible thing, and also leg ulcers, if it can be seen. And this, kind of pose quite a lot of issues in terms of that sort of identification. In terms of morbidity, we still use the word sickler quite often, and which, sort of depicts that, that person with sickle cell disease is always sick. And that really, I think, it's not a very, nice word or nice term in terms of stigmatization. We also have quite a bit of an impact in terms of education and employment. I think sickle cell pain and fatigue, which is now, sort of highlighted as one of the main symptoms, even from the recent worldwide survey, the SWAY survey, fatigue came out even in children. But I think frequent pain combined with extreme fatigue can lead to absenteeism, obviously, from both school and work. And sometimes the impression that people get is that this person is lazy, this child is lazy, or this person is lazy at work. And also I'm sure you would all realize that there isn't really sufficient support. Sickle cell disease doesn't fall under special educational needs category by default. We have to struggle to try and get them that support, which is usually quite difficult to get. There are individual requirements of employment, and dealing with employers is quite difficult as well. Simple example of, some people being able to work from home from the point of view of the employer, but the employer just refusing to allow them to doing that. So that poses problems as well. And then in terms of healthcare, I'm sure we have so many examples of these, but just to highlight some areas. So in terms of frequent pain and hospitalization, there's mistrust of patients about pain severity. Pain levels are underestimated. So for example, if you ask a patient to score their pain, they would probably score it, let's say something like 8 out of 10. But if you ask the health professional to do the same, they are really going to underestimate it, because the patient is probably not expressing pain in terms of grimacing or using, or shouting or something like that. That would be obvious. And in some cases are seen to be opioid dependent or addicted when they really aren't. And it has been shown in some studies in the States that stigma is actually associated with increased depressive symptoms and hospitalizations for sickle cell pain. Moving on again, problems around A&E is quite challenging. This has been highlighted in the PICA survey, which was conducted with the Sickle Cell Society, and Shibana and others were involved in that. living with sickle cell disease. And one of the main areas around that patients complain about is this poor experience because of staff not understanding sickle cell disease. But in terms of the use of the term sickler, which I mentioned earlier, there was actually a study done by emergency physicians, as they call them in the States. These are just A&E doctors. And they found out that using that term was associated with negative attitudes and not seeing sickle cell patients as people, and inevitably delivering a low quality of care. So it just shows how powerful such a term is in just degrading sickle cell patients and stigmatizing them from that point of view. We're going to have a talk about COVID specifically, but I just wanted to highlight one area because this came out with quite a number of patients that I was supporting during the so-called first wave. And the term that seemed to come out a lot was that they were feeling different. And this is a quotation from one of the patients, which she kindly agreed that I could share. She says that the COVID-19 pandemic has really opened my eyes onto how different I am from my able-bodied friends. It has brought to life all our differences, all our disparities, and all our most vulnerabilities, whether in health, race, or class. I thought it was just quite a powerful thing to say. She had a lot written down, but I just took this bit out, which just highlighted that issue of feeling different. And so in terms of how we can address stigma, I think there's just quite a lot that we can do, but just broadly speaking, I think the general public and society, that is at the forefront of everything. There needs to be more public awareness. There is, but it's not enough, obviously. Sickle Cell Society and others are doing quite a lot. Lots and lots of knowledge and understanding needs to be improved. We need to be able to dispel myths around sickle cell disease. And specifically for health professionals, we should be looking at education and training, which has been highlighted as well, all disciplines and at all levels. And I think we are all looking at ways in which we can, look at how training can be improved, how knowledge can be improved, be it nurses, doctors, psychologists, everybody involved in the care of sickle cell patients. That needs to be highlighted. And then, in terms of the patients themselves, I think particularly empowerment is very important for them. Advocacy, use of support groups, self-help, social media, which they tend to do anyway, but turning it around, making it more positive. Some patients are doing blogs, some patients are doing Instagram live stuff. And I think if you look at this as a conceptual model, basically with the patient at the center, it's just trying to, in a way, tell them that they should not let, sickle cell, in a way, become like themselves. So you don't equate yourself with your illness, you don't isolate yourself, you don't let stigma and create self-doubt and indignity, and it's joining a support group, whether it's face-to-face or in these days it's all virtual, and also on social media and seeking professional help. When it comes to health professionals, I think it's more or less obvious in terms of patient and parent education, in some cases counseling around the genetics when there is not enough understanding, or the counseling that the nurses do just about social issues and taking it from there. Psychologists in terms of psychological therapies and interventions, and also I think other health professionals are important. So around schools, universities, employers, as I've mentioned before, but also we shouldn't forget about social services and welfare. And I'm sure, some of us here today would allude to the fact that it's a complete sort of package and what we need to address, and as something that is very, very important from that point of view. So in summary, I would say that stigma in sickle cell disease continues to pose difficulties for patients and families. It needs to be addressed from a multifaceted, strategic point of view, which hopefully we are doing some, but need to do more, obviously, involving the general public, health professionals, educational institutions, employers, and social services, and so on. Thank you.
Thank you very much, Kofi. That was great. I'm going to move to questions. People, I've got an echo, so I'm not sure why. If people could put their questions in the chat, please, or raise their hands if anyone's got a question. Perhaps I'll just start. Kofi, we're talking about psychology through the ages. Do you think that our young people experience stigma differently to our old people? I mean, do you think it has changed over the last couple of decades, or do you think things are just the same as they ever were?
I think our young people are actually experiencing a little bit of a difference. The thing I see about the older patients is that obviously they had a really bad time when they were growing up with sickle cell because there wasn't much knowledge. And a lot of the issues that they were dealing with are still around today. So, for example, issues around A&E, hospitals, all that kind of issue about pain control and so on are still around. And for the young people, I think because we are doing slightly better, but at the same time, you have to remember that it's their parents who might still feel stigmatized. So, for example, a lot of the young people, I see the parents as what I would call, let's say, recent migrants as well. So they always have these cultural beliefs as well that they, sort of brought along with them. And so even though maybe, let's say, the children or young people may not feel stigmatization in the same way, they might highlight some areas which, for example, they, because they might talk about things like jaundice and being teased in school because they've got yellow eyes, or, being bullied because they are quite small and stuff like that. They may not look at stigma from that point of view, even though we would look at it that, yes, there is some stigmatization right there. So in a sense, I think the experiences are slightly different, even though the overall concepts are still the same.
Thank you. There's still no questions, so I could ask lots of questions. I'll carry on while I'm waiting for people to post or put their hands up. So Nikki Thomas here used to do some kind of anti-stigma training for the staff, and you didn't really talk about that. But I guess it's a question that I wonder, particularly kind of in the current climate and Black Lives Matter, about our own biases and our own kind of unconscious bias, I guess, how we stigmatize people, and how do you think we can address that, and are there ways we need to do it better?
So the thing is, obviously there wasn't enough time to go into much of the detail about training and so on, but I think that the thing about, so I think one of the things like you've alluded to about unconscious biases is that basically we have certain views which we don't necessarily see as being discriminatory or prejudicial, but there's a very strong link obviously in terms of discrimination as well as stigma. And I think one of the areas in which we need to work with especially health professionals, nurses and doctors and so on is the fact that we don't necessarily see things from the same point of view as the patient. And it is about the way you see, because one of the things that I think has been persisting all along is that we've always used this term about sickler. So we kind of use, the sicklers and all that kind of stuff. So it's like sometimes, even when you have, let's say, new nurses coming into the profession, there's that inherent background about issues to do with sickle cell patients without necessarily that person experiencing them. So I think one of the areas in which we can work is changing attitudes, because that definitely hasn't changed over a very long time, over the decades and so on. The attitudes are more or less the same. And I think it's the influence of, one person to another that keeps it going. And sometimes we don't necessarily see that we already have that kind of inherent bias towards patients.
Yeah, no, I think it's our kind of job, really, isn't it, as health professionals, to try and stop people when they say things we think are biased. I've got a few questions now. Umo, can I go to you first? Do you want to ask your question?
Sure. Just going back to your mention earlier about some people's resistance to first going to a medical resolution when they're maybe in crisis, or having in crisis or whatever, but instead leaning more towards the faith, or being stigmatized by the prejudices as like being cursed or whatever. Are there people in the faith community that are being sort of partnered with strategically to kind of address these things and have them as part of their community reach, basically, because they can really have an impact?
Yeah, I think that's very important. I mean, I'm not aware of specific sort of programs with faith healers or community leaders or whatever, but I would expect that in terms of part of the work that we do, we try and educate as much as possible. I mean, I've obviously been invited to a few churches, not of my own, to talk about sickle cell disease, and with large congregations of people, including pastors or ministers. So I'm hoping that that sort of education as an ongoing thing would help, and I'm sure others have done the same too.
Thanks, Kofi. I'm just going to go to Joan Walters and then on to Julia Darko. Joan, do you want to ask your question?
Yeah. It was an observation. Hi, Kofi. I agree with you.
Hi.
I agree with you totally about your point about using the term sicklers. In nurse training, it's many years now that we've been emphasising about not using pejorative terms, the asthmatic, the sickler, etc. But it's amazing, students after a few months in placements come back with using those terms, or people coming into specialties, they start using those terms, because there's always that nugget, that group of people that are still there. So I'm not sure what the answer is, how we can get around that.
Yeah, I mean, it's very difficult. I think the environment in which they go and work, once it's being used, you sort of then start to adopt it. And so despite all the teaching, all the training and the emphasis that you might offer, it's still a problem. I mean, that's why I say, you see new nurses or even junior doctors coming in, and they're already using the same terms, and they're already looking at patients in that sort of different way, and I think it's just something that we need to keep sort of in a way impressing upon them, not to use those terms, or to changing attitudes. I think is a very, very difficult thing, but we just have to keep at it. I don't think there's a magic bullet over time, and like you said, you've seen that kind of going on and on forever.
Thank you.
Thanks. Julia Darko, do you want to ask your question?
Hello, can you hear me?
Yeah.
Okay, perfect. Apologies, by the way, if you start hearing a screaming baby in the background. My question really was just thinking about how to break the cycle of stigma, or it sort of starting in the first place. So I just thought practically, when young, new parents often are discover kind of soon after the birth of their baby that their baby's been diagnosed with sickle cell disease, let's say. I don't know whether at that point there is sufficient support and counselling to really prevent any sort of stigma developing. I guess one of the ways, obviously, is sort of knowledge prevents stigma maybe developing, but whether there is actual kind of focused discussions around yeah, to kind of prevent those thoughts and feelings developing, which might then go on to be passed on to the child.
Yeah, I think that's a good idea. I mean, if you start something early, you're hoping that it would feed down through, you know, sort of like the younger generation or the children. But probably we don't have enough time. We don't spend enough time trying to address some of the difficult, you know, issues at the beginning, because I presume that, you know, you might get some education, you might get some counseling around, you know, sort of like the baby's needs and so on. But I think I agree with you that it should be kind of like ongoing and a bit more information about how to deal with some of these things. But I think it's difficult. For example, if you are, you know, obviously families are around, large families are around, and even within your own family, trying to dispel the myths and debunk some of the misconceptions, I think is a challenge as well.
Thanks. I'm going to come to Audrey Crossdale just for the last question, and then we'll move on. Audrey, do you want to make your kind of question comment? Perhaps you're muted. I could read it out. So Audrey just said, unfortunately, these issues around sickle cell have been around since I started working at St Thomas's and King's over 20 years ago. Not being believed when they're in a painful crisis situation is both demeaning and demoralising. I feel strongly that it should be part of the nurses' training programme. Also, parents should perhaps receive counselling when they've been given a sickle cell diagnosis. I think you can ask the second point, but I think the first point is just absolutely pertinent. It's dreadful that we still can't get on top of that. I don't know if you or Joe want to say anything. I mean, is it part of the nurses training programme? I don't think it is.
Hi. The problem is, because we did some work last year, time flies now, with the all parliamentary group, crisis, and we looked nationally at this, and it's just so variable up and down the country what people are exposed to. So we're in the phase now from that report and got support to create resources which all of the training institutions can actually use. But at the moment, no, it's not a consistent experience. It's just if you've got interested lecturers and you've got interested practitioners who want to come together.
Yeah, just a quick point. I mean, I'm sure we all do it, but involving obviously patients as well as parents in terms of experiencing, when it comes to teaching and training also helps quite a lot. But yeah, I mean, we just have to keep at it.
Okay.
Nikechi, you had your hand up. Did you want to speak? And then I'm going to go on to Gary.
Yes, thanks, Joan. I just want to echo what Joan said. It's not part of the training at the moment, but nurses and community nurses are trained to support the families. So from the day the diagnosis is given, from when we visit the parents, we work along closely with them. But I think it's a more cultural, deep-seated cultural issues that Kofi has identified. In some families, you can have two sisters with children with sickle cell. They don't want to discuss it. So nurses, we're supposed to support them, give them the insight and the correct information. The term sickler is very wrong, and we try and teach them to move away from that. And one thing I share with the families is that they can make sickle cell part of their life, but not all their life. Don't let the illness take over completely. That's what I would like to share. Thank you.
Thanks, Nikechi. And I'm going to point out that Rozelle's just highlighted scream.org, which is Sickle Cell Reach Equal Awareness Movement. And that's a website created by patients about changing perceptions. And they've actually got a great video about Call Me By My Name, which is just absolutely fantastic, addressing absolutely that issue. But Rozelle can maybe just come back to that when we come on to later. I'm going to move on because I'm running slightly late, apologies.